to my channel. So I'm just here today to give you guys a little spill on my labor and delivery rotation. It was amazing. I do wish that I had more rotations, but that's not how things fell due to the hurricane happening earlier during the semester. Kind of just threw off my clinical rotations, but that's okay. I still got the experience. So technically I got there at 6 a.m. on the unit. The patient that I was assigned to, she got admitted like at 4:30 a.m. She was having, contractions that were close together. So when she was admitted, she was 5 to 6 centimeters dilated. And so when the nurse that I was assigned to came in at 6:45, we did our rounds, we received reports. So she had a history of gestational diabetes. So she was taking metformin, and she was also on a sliding scale for insulin, but she never needed the coverage for that. So my patient, when we went assess her at about 7:15, she had dilated to 6 to 7 centimeters by then. She wasn't in a lot of pain. She was fine. We made sure that the fetal heart monitor was still placed properly, so we can get a good visual on the screen when we were reading the strips for that, as well as the contractions, so we can see what was the variability, if there were any A cells, D cells, and that kind of thing. And I was actually able to apply that from what I learned in class actually during the rotation, because if I hadn't covered that prior to that rotation, I'd have been like, oh, can you explain this a little bit more to me? But I just knew it from the T how to read the fetal monitoring strip, so that was pretty cool. So my baby that was going to be born, he was having minimal variability, which was fine, and his baseline heart rate stayed at 135, so that was good as well. So we went assess the mom, and also I was able to drain her bladder with the in and out catheter. And while I was in there, the nurse assessed her to see if her water bag had broken, which it did, but it didn't feel fully broken, because when the nurse assessed with the sterile gloves, she couldn't feel the baby's head, because sometimes she said when it breaks, you can actually feel the hair. So I thought that was pretty cool. So we went back to the nurse's station. Of course, we told the patient, if there's anything that you need, just press the button. So my patient, she wasn't getting Pitocin, but she did have an epidural when she was admitted. So I guess she was having a lot of contraction pain, but after the epidural, she wasn't feeling anything, of course. So she didn't rate any pain or anything like that. So she wasn't getting Pitocin. She was gonna get Pitocin after the delivery to make her have spontaneous contractions in order for her fundus to be firm and not boggy, because you don't want a boggy uterus, you want it to become firm. So we went back and assessed her at 8 a.m. her see how far she had dilated, and by then she was at an 8. And so we called the doctor, let her know. The doctor came in to see if she needed her water bag to be fully broken, which she did, because it was mostly broken, but the membrane was still a little bit attached. So the doctor did the procedure to, rupture the rest of the water bag. And that was pretty cool. I was glad that I got to see that. So that happened. So, she was continued to monitor. So we, kept looking at the strips, the fetal heart rate monitor. We prepped the room because, when she got to 8, that was pretty close to the 10. So we prepped the room with the items that the delivering doctor was going to need for that patient. And also we got the specimens together, the tubing that was going to be needed in order to they do a testing on the blood from the placenta to see if they had any abnormalities after the baby was delivered. So 9 o'clock comes, she's fully dilated, she's ready to push. It was amazing that I got to see it, because I never got the experience of seeing a C-section nor a vaginal delivery. So I thought it was cool. It literally took her 3 pushes to get the baby out. It was so quick, you guys, like fast. Like in the blink of an eye, the baby was out. He was crying when he came out. Of course, they you know, cleared his airway and stuff like that. And it's good that the baby was crying, getting those lungs active. So after that, they asked if she wanted to hold her baby. You know, they dried him off, but didn't bathe him or anything at that time, because she wanted to do skin to skin, and she wanted to start breastfeeding him, because that was what she chose to do. She did that with her other 2 babies, so she wanted to do that with this as well. So the lactation nurse came in, which the mother didn't even need help getting the baby to latch on, because she had so much experience prior to having her other 2 kids. So that was pretty cool as well. So after the breastfeeding, we just kept assessing her to see if her sensation came back, because she had that epidural. And so for her, it took like a very long time for her sensation to come back. And when they're in recovery like that, you can't just send them up to postpartum. You want them to have all their sensation back. You want them to be able to bend their knees, wiggle their toes. So we just held her until it was time to send her up when she got that feeling back. But during the process, the mom that was going to be receiving them, the nurse that was going to be receiving them on the postpartum unit, she came, assessed the baby, listened to his lung sounds, listened to his heart. After breastfeeding, she bathed him, you know, had him all snuggled up and warm, because you want to prevent hypothermia when the baby is delivered, of course, because they lose a lot of heat very quickly.